myelinated fibers are nerve fiber of the somatic nervous system more than 1 micrometer in diameter. All preganglionic fibers of autonomic nervous system. The example of non-myelinated nerve fibers are nerve fibers of somatic nerves system less than 1 micrometer in diameter. All postganglionic fibers of autonomic nervous system. The conduction of action of potential along an axon. When the nerve is stimulated, the plasma membrane becomes depolarized and an action potential tiny electrical charge is generated. This action potential then spreads along the plasma membrane. The speed of conduction of an action potential is faster along myelinated nerve fibers as it jumps from one node to other and is called the saltatory conduction. Salters to leap jump. The speed of conduction is slower in non-myelinated fibers. At advanced of the action potential is consistent and a moderate pace. Thus, the conduction of action potential in myelinated fibers is like a grasshopper jumping whisper in non-myelinated fibers. It is like a grasshopper walking. Transmission of impulses. In nervous system, the information passes from one place to the other in form of an action potential or nerve pulse. Nerve impulse is akin to a tiny electrical charge generated due to the exchange of sodium and potassium ions across the plasma membrane following a stimulus. Nerve impulse travels progressively along a nerve fiber and then passes on through the neurons across the synapse. Junction at which the nerve impulse passes from one neuron to another is called synapse. The synapse is the contact between two neurons by contiguity and not by continuity. Types of synapse. Anatomically, depending upon the parts of two neurons coming in contact and the direction of transmission of a nerve impulse, the synapses are classified into following types: exodendritic, axosomatic, dendrosomatic, dendrodendritic, exoaxonic. Structure of synapse. It consists of synaptic knob of parasympathetic neurons and plasma membrane of the plasma synaptic neurons. The parasympathetic knob contains synaptic vehicles filled with neurotransmitter. The plasma membranes of two neurons opposed to each other at synapse are called the parasympathetic and postsympathetic membranes. A small gap between these two membranes, 20 to 30 nanometers, is called the synaptic cleft. Mechanism of transmission of impulse across the synapse. All the nerve impulse arrives at the parasympathetic knob. The neurotransmitter is released into synaptic cleft, where it binds with the receptor located on the postsynaptic membrane. This causes the depolarization of the postsynaptic membrane, leading to generation of nerve impulse in the postsynaptic membrane. In this way, nerve impulse passes from one neuron to another. Neurotransmitter. It is chemical substance involved in transmission of nerve impulse across the synapse. There are number of the neurotransmitter, but the most common form of them is acetylcholine. The acetylcholine, once liberated in the synaptic cleft, binds with the receptor of the postsynaptic membrane to depolarize it. The remaining acetylcholine in the synaptic cleft is broken down into acetate and choline by an enzyme called the acetylcholine esterase. The nerve impulse causing depolarization of the postsynaptic membrane is called the excitatory nerve impulse, whereas the nerve impulse causing the hyperpolarization of the postsynaptic membrane is called the inhibitory nerve impulse. Clinical correlation. The synaptic transmission may be affected by the various drugs. Caffeine is a stimulant that increases the rate of transmission across the synapse. That is why office workers are very fond to taking tea and coffee. Transmission of neurotransmitter structure of the synapse. Exodendritic, এই ছবিগুলো কিন্তু লাগবে। mechanism of transmission of the nerve impulse at synapse. Excitatory and inhibitory synapse is a motor neuron. Nerves. The term nerve refers to the peripheral nerve. The peripheral nerve consists of bundles of nerve fibers. The structure of a nerve or peripheral nerve. Each nerve consists of bundles of physically of nerve fibers and connective tissue. Each nerve fiber is enclosed in a delicate connective tissue sheath called endoneurium. Endoneurium. Each group of nerve fibers fasciculus is surrounded by a connective tissue sheath called the perineurium. The entire nerve is surrounded by a dense connective tissue sheath called the epineurium, which contains blood vessels. Three connective tissue sheaths provide a considerable mechanism straight of peripheral nerve and form half of the bulk of the nerve. Classification of the nerves. Nerves are classified into following three types: motor nerve, sensory nerve, mixed nerve. Sensory nerve transmit impulse from the receptor in periphery to the central nervous system. The motor nerve transmit motor impulse from the central nervous system to the effector organ, skeletal muscle. The loss of motor nerve supply leads to degeneration of the skeletal muscle fiber. Mixed nerve fibers of both motor and sensory fibers. Reflex action. A reflex action is an autonomic response to a stimulus without conscious thought. It is protective in nature. The surrounding involved to carry out this reflex are sensory receptors, afferent neuron, association neuron, efferent neuron, effector organ. Pasta. Sensory receptor, afferent or sensory neuron, association or connected neuron, efferent or motor neuron, effector neuron, organ. The classic example of the reflex action in the withdrawal reflex, such as when a pin is pricked in a hand, the receptor is stimulated. Nerve impulse produced by painful stimulation reaches the spinal cord through a sensory afferent neuron. The impulse is passed to the motor neuron via an association neuron interneuron, which turns the stimulus in flexor muscle, head effector organ, and the result hand moves and withdrawn away from the pin. উৎস রিফ্লেক্সের কাজ কী হয়? Various other reflexes like ocular, cardiac, calf, intestinal operate in the similar function. Various other reflexes like ocular, cardiac, calf, and intestinal operate in a similar fashions. Differentiation and regeneration of nerve after injury. Injury is peripheral nerve are quite common. They may occur due to compression, traction, trauma, intermuscular junction, cut, etc. There are three types of nerve injuries are follows: neurometers, neuronesis, axonesis, neuroparalysis, neuronesis, interaction of axon and its myelin sheath, axonesis, interaction of the axon with preservation of the myelin sheath, neuropyrexia, both axon and myelin sheath are preserved. Recovery can occur in case of neuropyrexia and axonomesis, but some degree of function loss is invariable with neuronesis. When a nerve is cut, a series of degenerative and regenerative change follows. Degeneration. When the nerve fiber is cut, the distal segment of axon that is served from the cell body degeneration. This is called
Valerian degeneration. The process is named after Valerian, who first described in 1850 the histological effect of nerve degeneration. There is complete fragmentation of nerve fiber, including its myelin sheath. However, myelin-producing sheath cells, Schwann cells, survive. In addition to degeneration of distal segment of axon, Degenerative changes are seen in all cell body. Cell body swells and nucleus becomes eccentric. Cell body swells and nucleus becomes eccentric. Nacelle bodies degenerate and form granules which are dispersed throughout within the cell body. This process is called chromatolysis. Figure 12.12 Reflex arc withdrawal reflex. The components of reflex are labeled in order in which action potential passes through them. The five components are sensory, receptory, afferent neuron, association neuron, afferent neuron, and an effector organ. The changes that occur in cell body following an injury to its axon is called retrograde degeneration. Regeneration. The macrophages migrate to the site of lesion and phagocytosis the debris.
Okay. Abducted supplies the extraocular muscle. Facial supplies muscle of the facial expression. And lacrimal and submandibular or sublingual salivary glands. Vestibular concerned with the sense of hearing and balance. Glossopharyngeal provides sensory innervation to tongue and pharynx, and the motor supply to the pharyngeal muscle. Vagus provides motor supply to gut, heart, and the respiratory tracts. Sensory innervation to tongue, thoracic abdominal viscera. Accessory provide motor innervation to muscle of palate, pharynx, larynx, and neck. Hypoglossal provides motor supply to muscle of tongue. A pair of small nerve called the nervi terminalis is recently discovered. It is attached to the brain ahead of all other cranial nerves and is designed as O pair. Zero pair no O pair. It is throat area. Spinal nerves. There are 31 pairs of spinal nerves which arises from the spinal cord within the vertebral canal and come out of the throat intervertebral foramina. These 31 pairs of nerves are as follows: 8 pairs of cervical nerve, 12 pairs of thoracic nerves, 5 pairs of lumbar nerves, 5 pairs of sacral nerves, 1 pair of coccygeal nerve. Typical spinal nerve. A typical spinal nerve arises from the spinal cord by two roots, anterior and posterior. Anterior root is motor and arises from the anterior hulls, and posterior root is sensory and process a knot-like swelling called the posterior dorsal root ganglia consists of nerve cell bodies of sensory nerve fibers. Two roots come up to the vertebral canal through the intervertebral foramen and then join each other to form the nerve trunk, which divide into a small posterior ramus and large anterior ramus, both containing motor and sensory fiber. Thoracic spinal nerve from T3 to T11 are considered as typical spinal nerves. A typical spinal nerve, dorsal ramus and ventral ramus. Posterior ramus curved backward around the vertebral column to supply the muscle of the back and skin covering this muscle. The anterior ramus runs anterolaterally around the body wall to supply the muscle and skin of the anterolateral way to body. The student should not confuse the rami branches into which the nerve divided into roots by which it is formed. A small dorsal ramus and large ventral ramus. The small dorsal ramus divides into lateral and medial branches which supply the muscle, and one of them sends a branch called the posterior cutaneous branch which divides into lateral and medial branches. The lateral vertebral ramus runs along the lower border of the corresponding rib and supplies intercostal muscle. Further, it gave rise to lateral and anterior cutaneous branches in the mid-axillary line and just lateral to the sternum, respectively. Lateral cutaneous branches further divided into posterior and anterior branches, whereas the anterior cutaneous branch divided into lateral and medial branches. Distribution of sympathetic fiber through the spinal nerves. Soon after its formation, the ventral rami receives a cylinder bundle of myelinated fibers. The gray remus communicates from the corresponding sympathetic ganglia of the synaptic trunk. The nerve fibers of each gray remus arises from the cells in the sympathetic ganglia. These are postganglionic synaptic fibers. The fibers which enter the ventral remus are distributed through all its branches. They also enter every branch of each dorsal remus by coursing back in the corresponding ventral remus to enter the dorsal remus. Sympathetic fibers supply to the smooth muscle of blood vessel and muscle associated with hair, erectors, pylori, and sweat glands. The ventral rami of the east thoracic and upper two lumbar spinal nerves are also connected to the corresponding sympathetic ganglia by another cylinder bundle of myelinated nerve fibers called white remus communicates. The fibers of the bundle are preganglionic sympathetic fibers, which arises from lateral gray horn of spinal cord and relay in the sympathetic ganglion. The difference between the white and gray rami communicates are given. Dermatome. The cutaneous are supplied by one spinal nerve through both its rami called the dermatome. Figure 12 depict the dermatomal map of the body of the sensory cutaneous distribution of the spinal nerves. Pattern peripheral distribution of the spinal nerve, anterior view and posterior view. With the exception of the first central nerve, cervical nerve C1, all the spinal nerves are associated with the specific dermatome. Typically, a dermatome extends around from anterior to posterior median line. The upper of each zone is supplemented by the nerve above, the lower half by the nerve below. No area of skin is supplied by the single spinal nerve because adjacent dermatomes overlap. Difference between the white and gray matter, gray rami communicates. The type of fibers, myelinated, non-myelinated. Source of origins, lateral horn cell of spinal cord, cells of sympathetic ganglion. Destination, relay in the sympathetic ganglia, preganglionic fibers, distribution to blood vessels, hair, sweat gland through the branches and posterior rami of the spinal cord. Clinical correlation. Dermatonal map. The knowledge of the dermatonal map is important to clinical consideration of nerve damage because loss of sensation in a dermatonal pattern provide a valuable information about the location of nerve damage. Due to overlapping of contiguous dermatomes, anesthesia, loss of sensation will not occur unless more than two spinal nerves are involved in a lesion. If an injury involves only one spinal nerve, the sensations are decreased or altered but not completely lost. In the turn, the arrangement of the dermatomes is simple as each dermatome extends around the body wall from the posterior median line to the anterior median line in the limbs. The arrangement of dermatomes is completed firstly because the spinal nerves supply the limbs from plexus before innervating the skin, and secondarily because the limbs rotate during the embryonic limb plexus formation by the spinal nerve. In general, except for thoracic nerve T3, T12, the anterior primary rami of all spinal nerves join and then split again to form a network of nerve called the nerve plexus. There are three major nerve plexus: cervical plexus, brachial plexus, lumbosacral plexus. Cervical plexus. It is formed by the anterior primary rami of cervical 1, 2, 3 and cervical 4 spinal nerves and innervates the head and neck. Brachial plexus. It is formed by the anterior primary rami of cervical 6, cervical 7, cervical 8 and thoracic 1 and innervates the upper limb. Lumbosacral plexus. It is formed by the lumbar 1, lumbar 2, lumbar 3, lumbar 4 and sacral 1, sacral 2, sacral 3 and innervates the lower limb. Autonomic nervous system. The autonomic nervous system controls involuntary activities of the body such as the activities of smooth muscle, cardiac muscle and glands. Like somatic nervous system, the autonomic nervous system also consists of two components, afferent and efferent. Afferent component is identical to that of somatic nervous system, but the efferent component differs from the somatic nervous system. The basic difference between the afferent component of somatic nervous system and efferent component of autonomic nervous system is that the somatic efferent fibers directly pass from central nervous system to the somatic efferent organ. Vice versa, skeletal muscle, where the autonomic afferent fibers don't directly pass from central nervous system to the visceral afferent organs, but first they relay the autonomic ganglia outside the central nervous system, and then fibers arising from ganglionic cells supply the effector organs. Thus, somatic afferent motor pathway consists of only first order neurons arising from the central nervous system, while the autonomic afferent pathway consists of the first order neurons arising from central nervous system and second order neurons arising from autonomic ganglia. The first and second order neurons are autonomic afferent pathway and are called the preganglion and postganglion neurons respectively. The nerve impulse passing through autonomic motor pathway causes the stimulation or inhibition of the glandular secretion and contraction or relaxation of smooth cardiac muscle. Subdivision of the autonomic nervous system. Afferent component of autonomic nervous system is divided into two divisions: sympathetic nervous system, parasympathetic nervous system. Sympathetic nervous system. Preganglionic sympathetic fiber arises from the spinal cord only, from the lateral gray column of the spinal cord, from the thoracic 1 to lumbar 2 segments. Hence, the sympathetic outflow is termed as the thoracolumbar outflow. Parasympathetic nervous system, the preganglionic fiber arises from brain as well as from spinal cord. In the brain, they arise from the visceral afferent nuclei and they leave the cranium through the 3rd, 7th, 9th and 10th cranial nerves called the cranial outflow. In the spinal cord, they arise from the lateral gray column of the 2nd, 3rd and 4th sacral segment sacral outflow. Therefore, in general, parasympathetic outflow is termed as craniosacral outflow. This showing the afferent component of the autonomic nervous system. The parasympathetic outflow is shown in blue and sympathetic outflow is shown in red. Characteristic feature of sympathetic and parasympathetic supply. এটা হচ্ছে সিম্প্যাথেটিক thoracic outflow is red, sympathetic হচ্ছে লাল আর ব্লুটা হচ্ছে প্যারাসিম্প্যাথেটিক গ্যাংলিয়া থেকে। আচ্ছা, characteristic feature of the sympathetic parasympathetic supply. All the part of the body whereas the somatic or visceral receive sympathetic supply by parasympathetic supply has no somatic distribution, which supplies only viscera. Even some viscera like the supranatal glands and goners have no parasympathetic supply. Function of sympathetic and parasympathetic nervous system. In general, sympathetic stimulation mobilizes the body energy for flight and fright, whereas the parasympathetic stimulation show down the body process to conserve and restore energy. The effects of sympathetic and parasympathetic stimulation of some organs are enumerated. From the inner interpretation of the efferent present in table, clear that the effects of these two systems are the antagonistic effects on heart, pupil, GIT and respiratory tract, complementary effects on salivary glands, cooperative effects on urinary and reproductive system. Effects of sympathetic and parasympathetic clinical correlation. Sympathetic and parasympathetic overactivity. The sympathetic system stimulates at the time of stress and strain. Sympathetic overactivity causes the rise in blood pressure, increased heart rate, tachycardia, increased respiratory rate and sweating. Overactivity হলে শুনো, sympathetic parasympathetic overactivity কাজ করে তাহলে সোয়েটিং বেশি হয়, বুঝছো? ব্লাড প্রেশার বেড়ে যায়, ইনক্রিজ হার্ট রেট হয়, ট্যাকিকার্ডিয়া হয়, ইনক্রিজ রেসপিরেটরি রেট। The autonomic nervous system is divided into two divisions: sympathetic nervous system and parasympathetic nervous system.
ওদেরকে ট্যাগ না করবো আসি কি তো এতগুলো লোক গেছে রমেলি বড়ুয়া, ওপালি বড়ুয়া, অজয় বড়ুয়া, ত্রয়ী বড়ুয়া।
ওদের
অজয় বড়ুয়া।
কোনো ছবি নেই।
রুমকি পুষ্পা।
তারপরে sympathetic nervous system. Preganglionic sympathetic fibers arises from a spinal cord only, from the lateral gray column or spinal cord from T1 or thoracic lumbar segment. Hence, the sympathetic outflow is termed to thoracolumbar outflow. Parasympathetic nervous system. The preganglionic fibers arises from brain as well as from the spinal cord. In the brain, they arises from the visceral efferent nuclei and leave to the cranial through 3rd, 7th, 9th and 10th cranial nerves, cranial outflow. In the spinal cord, they arises from lateral gray column of 2nd, 3rd and 4th sacral segments and sacral outflow. Therefore, in general, the parasympathetic outflow is termed as craniosacral outflow. Characteristic feature of sympathetic and parasympathetic supply. All the pairs of the body where whether somatic or visceral receive this sympathetic supply, but the parasympathetic supply has no somatic distribution, which supplies only viscera. Even some viscera like the superficial glands and gonads have no parasympathetic supply. Function of the sympathetic and parasympathetic nervous system. In general, sympathetic stimulation mobilize the body energy for fight and fright, whereas the parasympathetic stimulation shows the down and body process to conserve and restore energy. Efferents of sympathetic and parasympathetic stimulus of the some organs and enumerated. From the interpretation of the efferents presented in table 12.3, it is clear that the effects of these two sympathetic are the antagonistic efferents to heart, antagonistic efferents on heart, pupil, GIT and respiratory tract, complementary effects on salivary glands, cooperative effects in urinary and reproductive system. Clinical correlation. Effects of the sympathetic and parasympathetic overactivity. The sympathetic system is stimulated at the time of stress and strain. Sympathetic overactivity causes the rise of blood pressure, increase the heart rate, tachycardia, increase the respiratory rate and sweating. Organ and effects of sympathetic and parasympathetic stimulation. Organ: pupil of eye, dilatation and constriction of parasympathetic effects. Lacrimal gland, vasomotor, secretomotor. Salivary glands, constriction of the blood vessel, produce the various viscous vulva. They produce the watery saliva. Bronchial gland, inhibition of secretion and secretion of, and the increases secretion. তারপর হচ্ছে bronchus dilatation and constriction. The muscles of the gastrointestinal, inhibition of the gastric motility but the constricted sphincter, increase the peristalsis but reflects the sphincters. তারপর হচ্ছে glands of gastrointestinal inhibition secretion, increase the secretion. Muscle of bladder, relaxation of the muscle of bladder wall but constriction of the sphincter, sympathetic effect. আর parasympathetic হচ্ছে contraction of the muscle of the bladder wall but relaxation of the sphincter. Blood vessel হচ্ছে vasoconstriction, vasomotor. Parasympathetic কোনো effect নেই, no effect. Sweat glands, pseudomotor, sweating, no effect. Muscle of hair follicles, erectile pilomotor contraction, no effect. Penis causes the ejaculation and parasympathetic causes the erection. Heart increase the heart rate and parasympathetic decrease the heart rate. Sympathetic inhibition cause the vasoconstriction of blood vessel all over the body except those in skeletal muscle. তারপর আমরা সোয়েটিং পড়ছি। এরপর হচ্ছে ডাইলেটেশন অফ দি পিপিল, ড্রাইনেস অফ দি মাউথ, লসেস অফ দি অ্যাপিটাইট, constipation. The parasympathetic overactivity causes the constriction of the pupil, decrease in heart rate, bradycardia, increase in motility of gut to help the evacuation. The sympathetic system and sympathetic stimulates at the time of stress and strain. These days, most people suffer from high blood pressure and constipation because they live in an era of the stress of strain. Fibers, neurotransmitter of the autonomic nervous system. Autonomic nerve fibers release two types of muscles which release the acetylcholine. Neurotransmitter released by sympathetic cord and parasympathetic nerve fibers. Innervation. Segmental innervation of decreased viscera arises of skin where the pain is referred. Appendix, skin around the umbilicus T10. Gallbladder causing irritation of the right dome of diaphragm. Skin over the tip of the right shoulder. Cervical 3, cervical 4, cervical 5, phrenic or supraclavicular nerves. The spleen causing the irritation of the left dome of diaphragm. Skin over the tip of left shoulder. Cervical 3, cervical 4, cervical 5, phrenic and the supraclavicular nerves. Heart, skin over pericardium, medial side of the arm and forearm. T1, thoracic 1, thoracic 2, thoracic 3, thoracic 4. Ureter, skin in loin, groin, scrotum, labia majora. Thoracic 11, thoracic 12, lumbar 1, lumbar 2. And B. Fiber, the fiber which release the acetylcholine and act as the cholinergic fibers, and the fibers which release the norepinephrine or noradrenaline are termed as the adrenergic fiber. Clinical question. Drug atropine derived from redly nightshade plant Atropa belladonna inhibits the parasympathetic stimulation of the constricted pupillary muscle of the iris, leading to dilatation of the pupil of the eye. Therefore, extracts of this plant were used by women during the middle age of the dilated their pupils in the order to enhance their beauty. Belladonna, beautiful woman. Nowadays, in clinical practice, atropine is used to dilate the pupil during the eye examination. Afferent component of the autonomic nervous system. As described earlier, afferent fibers of autonomic nervous system are integral to the afferent fibers to the somatic nervous system. The cell bodies of the afferent fibers, first order sensory neurons, as afferent nervous system are located in the dorsal root ganglia of the spinal nerves and sensory ganglia of the cranial nerves. The impulse carried varied by afferent fibers and afferent nervous system are associated with visceral reflex, usually at unconscious level. Sensation of hunger, thirst, nausea, sex desire, distension of bladder and blow, and visceral pain. Visceral pain is commonly encountered in day-to-day clinical practice. The sensation of visceral pain are conveyed by sympathetic afferent fibers. Visceral pain is caused by either of the following: stretching of the solid viscera, distension of the hollow viscera, spasm of the smooth muscle of the viscera, or ischemia of viscera. Three types of pain may be encountered. True visceral pain, it is dull and poorly localized over the viscera. Sharp pain, it occurs due to the inflammation and felt on the body surface close to the viscera. Referred pain, it is located acute pain felt on the body surface away from the affected viscera. The referred pain is of the great clinical significance. Referred pain, the pain arising from the decreased viscera is referred to an area of skin which is supplied by the same segments of spinal cord, which supply the decreased viscera. The segmental innervation of the decreased viscera and areas of the skin where the pain is referred are listed in table 12.3. The important site of referred pain are shown in figure 12 to 25. Important site of referred pain: tip of right shoulder, gallbladder pain, tip of right shoulder, skin around the umbilicus, appendix, tip of right shoulder, karmic signs, cardiac pain, spleen and ureteric pain. Golden facts of remember: number of the neurons in the body about 100 billion, number of the neuroglia in the body about 1000 billion. Most important property of the neuron: excitability and conductibility. Most excitable part of the axon hillock. Longest neuron in the body: sensory neurons are the first sacral spinal nerves. Largest neuroglia: astrocytes. Smallest neuroglia: microglia. All the neuroglia develop from the neural crest except microglia which develops from the mesoderm. Commonest variety of synapse, exodendritic. Most common type of neurons in the body, multipolar. Largest sensory receptors, Pacinian corpuscles. Cell bodies of the primary first order sensory neurons are located outside the central nervous system except cell bodies of the primary sensory neurons and cephalic neurons nucleus of the trigeminal nerve with or within the central nervous system. Cell bodies of the all motor neurons are located within central nervous except those of postganglionic motor neurons of ANS in the peripheral ganglia. All the viscera are supplied by the postganglionic autonomic fibers except adrenal medulla, which is supplied by preganglionic autonomic fibers. Largest cranial nerve, trigeminal or fifth cranial nerve. Longest cranial nerve, vagus. Largest হচ্ছে trigeminal আর longest হচ্ছে vagus.
Vegas.
10th cranial nerve. Esperance cranial trochlear or fourth cranial nerve. All the cranial nerves emerge from the ventral except the brain, except trochlear nerve, which emerges from the dorsal except of the brain. All the spinal nerves are associated with a specific dermatome except first cervical nerves as it has no cutaneous distribution. The vertebral just follow the হয়েছে আমার শেষ 11 কথা বলে ফেলছি লার্জেস্ট হচ্ছে ট্রাইজেমিনাল লংগেস্ট হচ্ছে ভেগাস স্মলের হচ্ছে
Bipolar neurons are found at all of the following sites except cerebrospinal ganglia. All the neuroglia are derived from neural crest except microglia. Neuroglial cells that form myelin sheath around the peripheral neuron nerve fiber are neuroleumocytes. Which of the following neurons are pseudo-unipolar? Neurons of cerebrospinal ganglia. A collection of nerve fibers outside the CNS is called a nerve. The commonest type of synapse is exodendritic. The commonest neurotransmitter is acetylcholine. Select the incorrect statement. All preganglionic parasympathetic fibers secrete norepinephrine. Nisl granules are absent in all except cell body, pericardium. Glial cell which acts as phagocyte is microglia. The outer covering of peripheral nerve is called epineurium. Endocrine system. Chapter 13. Learning objectives. Describe the structure and the functions of pituitary gland. Discuss the position of thyroid gland and its related structures. Describe the microscopic structures of thyroid gland and outline the action of the thyroid hormones. Elucidate the position and growth structure of parathyroid gland and outline the function of parathyroid hormone. Demonstrate location and structure of suprarenal glands and discuss the action of hormones secreted by adrenal cortex. State the position of pineal gland and outline its functions. List the hormones secreted by the endocrine pancreas and describe the action of insulin and glucagon. Correctly solve the review questions given at the end of the chapter. Introduction. The endocrine system is one of the two major control systems of the body, the other being the nervous system, and plays an important role in maintaining the homeostasis of the body. The disorders of the endocrine system led to important clinical and condition. such as diabetes mellitus, diabetes insipidus, Cushing syndrome, and varieties of reproductive malfunctions. Components of endocrine system. The endocrine system consists of endocrine glands which exist as a separate distinction organ. For example, pituitary, thyroid, and parathyroid glands. Scattered mass of endocrine cells within the exocrine glands. For example, aisles of Langerhans within pancreas, interstitial cell of testis, corpus luteum of ovary, etc. Diffuse neuroendocrine cells, for example, neuroendocrine cells. 2. A scattered mass of endocrine cells within the exocrine glands, for example, islets of Langerhans within pancreas, interstitial cell of the testis, corpus luteum of ovary, etc. Diffuse neuroendocrine cells, for example, neurocrine cells distributing in the linear epithelium of duodenum, etc. Endocrine glands. The endocrine glands are ductless glands and pores their secretion directly into the bloodstream. The cells of endocrine glands abut directly against the vascular channels. Most of such groups of gland cells are arranged in cord or plates. These cords are separated by synoid or blood capillaries. The secretion of endocrine glands is known as hormone or chemical messenger, which cause activation or inhibition of even a distinctly situated target issue or an organ. The hormone chemical messenger can be classified into the following four main types: proteins such as thyroid stimulating hormone, growth hormone, parathyroid hormone, etc. Steroids such as testosterone, progesterone, etc. Small peptides such as vasopressin, thyroid releasing hormone, etc. Amino acid derivatives such as thyroxine, adrenaline, and noradrenaline. A clinician needs information on several aspects to understand the role of endocrine glands and their secretion in different tissue and organ of the body. This information pertains to anatomy and location of each gland, hormones secreted by each gland, factors regulating the secretion of each hormone, factors causing hypersecretion and hypersecretion of each hormone. The important endocrine glands of the body as following: pituitary gland or hypophysis cerebri, thyroid gland, parathyroid gland, suprarenal glands, pineal gland, thymus gland. Pituitary gland. The pituitary gland is the most complex endocrine gland. It weighs about 0.5 gram and its normal dimensions are 10 mm, 30 mm, 6 mm. It is located in the bony fossa of the skull, pituitary fossa or hypogseal fossa, or salacrosia, below the hypothalamus and connected to by a stalk of tissue called infundibulum. The optic chiasma is related to the roof of the hypophyseal fossa. Parts of pituitary gland. The pituitary gland consists of two distinct parts: adenohypophysis, anterior pituitary; neurohypophysis, posterior pituitary. Pituitary gland, thyroid gland, thymus gland, adrenal gland, islets of Langerhans, ovaries, testes in male. Location of male endocrine glands: pineal gland, hypothalamus, optic chiasma, bony body of sphenoid bone. Pituitary gland A. Location of the gland. B. Subdivision of the gland. Adenohypophysis. Anterior pituitary. It is divisible into three zones: paras anterior, paras intermedia, paras tuberalis. Paras anterior. It forms the major part of adenohypophysis and consists of an stomosing cord of cells that are surrounded by sinusoids, the arrangement most suited for direct discharge of hormones into the bloodstream. The cells forming the cords are of the following two types: chromophobes, chromophils. Development of adenohypophysis and neurohypophysis. Chromophobes are smaller in size and have little affinity for histological stains, hence the name chromophobe. These cells have little cytoplasm which usually does not have any granules. The chromophores are considered as exhausted cells in interactive phase of chromophils. Chromophils are stainable and larger than chromophores and process secretory granules. The chromophils are of two types: acidophils and basophils. Acidophils, according to the function, the acidophils are classified into the following three types: somatotrophs, they regulate body growth by secretion of GH growth hormone. Corticotrophs, they act supranatal glands by stretching ACTH. And adrenocorticotrophic hormone. Mammotrophs, they act on mammary glands by secreting prolactin hormone. Basophils, according to their function, the basophils are classified into two types: thyrotrophs, they act on thyroid gland by secreting TSH, thyroid stimulating hormone. Gynalotrophs, they act as gonads by secreting FSH, follicle stimulating hormone LH, luteinizing hormone in females ICSH, interstitial cell stimulation hormone in males. Paras in intermedia. It is a narrow zone consisting of small cells. The part intermedia is separated from pars interior by the intragradual cleft. The cell of pars intermedia secrete melanocytes stimulating hormone MSH. Note 12. In amphibians, FSH controls the disposal of melanin granules in melanocytes and are responsible for altering the color of their skin. Pars tuberalis is an onward tubular extension of the pars interior surrounding a part of the infundibulum. The cells within it are basophils and contain some granules. The functions of pars inventibularis is uncertain. Clinical correlation: effects of hypersecretion of anterior pituitary. The hypersecretion of growth hormone GH and anterior pituitary leads to gigantism and acromegaly. The most common cause of hypersecretion of GH is pituitary tumor. The excessive secretion of GH leads to excessive growth of bones, enlargement of internal organs, growth of excess connective tissue. Gigantism occurs when there is excess secretion of GH while epiphyseal cartilages of long bones are still growing. As a result, there is exaggeration of and prolonged growth in the long bones, resulting in gigantism. The affected individuals are abnormally tall, some may be 3 feet tall or so. Acromegaly occurs when there is excessive secretion of GH after the ossification is complete. The affected individual presents following clinical features: prominent jaw and heavy bone ridges above the eyes, increased demeanor of figures, toes, hands, and feet, bulbous or broad nose, enlarged tongue, no increase in height. Effects of hyposecretion of anterior pituitary. The hypersecretion of GH of pituitary is infant and children leads to dwarfism. Pituitary dwarfism. The affected individual is a small structure but is well proportioned and is mentally developed. Mental development is not affected. neurohypophysis, posterior pituitary. Developmentally, it is a ventral outgrowth of the floor of dencephalon, but it does not contain neurons. The neurohypophysis consists of a narrow infundibulum and the swollen parts were nervosa. Infundibular process.
A small oval yellowish brown bodies measuring about 2 into 3 into 5 millimeter, roughly equal to the size of the split pie. The two superior and inferior parathyroid glands are found embedded on the posterior surface of each lateral lobe of thyroid gland. Structure. The cells of the parathyroid glands are densely packed in masses or cords rather than in follicles. Hormones secreted by parathyroid glands. Parathyroid glands secreted parathyroid hormone. Parathyroid hormone, also called the parathormone, is important to maintain the blood calcium level. It metabolizes calcium from bones and raises blood calcium level. In addition, inhibits osteoblast activity and promotes the osteoclastic activity of bone. Further, it converts vitamin D into an active principle, 1,25-dihydroxycalciferol in the kidney, and thus increase absorption of the calcium into the kidney. And increasing calcium level in blood hyperactivity depresses the parathyroid activity. These balance effects maintain blood calcium at a nearly contained level. Posterior pituitary gland, superior thyroid artery, posterior aspect of thyroid gland, inferior thyroid artery, epiglottis, trachea, parathyroid glands. Position of the parathyroid glands. Parathormone and calcitonin forms the thyroid gland act in a complementary manner to maintain blood calcium levels within a normal range. This is needed for the following function: muscle contraction, blood clotting, nerve impulse transmission. Blood supply. Parathyroid glands are supplied by the inferior thyroid artery. Clinical correction: hypoparathyroidism. It most commonly occurs due to the atrophy or inadvertent surgical removal of the parathyroid glands. It leads to by fall in blood calcium level, hypocalcemia, which causes the hyperreactivity and painful skeletal muscle spasm, causing characteristic inward bending of hands, forearms, and feet. These produce a clinical condition called the tetany. Hyperparathyroidism, hyperbolic tetany. It most commonly occurs due to the parathyroid adenoma. It leads to the osteoporosis and consequent pathological feature, formation of renal calculi. Muscle weakness and calcification of the soft tissue. Suprarenal glands or adrenal glands. There are two suprarenal glands and the right and left. One situated on the upper pole of each kidney. The right suprarenal gland is shaped like a hat and left is similar in shape. Left kidney is there retroperitoneal and surrounded by the abundant adipose tissue. There are about 4 cm long, 3 cm thick. Suprarenal gland দেখো কিডনির উপরে এই যে position of the suprarenal gland দেখছো এই position of the suprarenal gland. Structure and secretion of the hormone. Each suprarenal gland is composed organ consists of two distinct parts, which are developmental structure and functionally different. These parts are an outer part called the adrenal cortex and the inner part called the adrenal medulla.
The adrenal cortex develops from mesoderm, whereas adrenal medulla develops from neural crest. Adrenal cortex. The adrenal cortex is the outer large part of the adrenal gland. It is divided into 3 distinct zones: an outer zone called zona glomerulosa, a middle zone called zona fasciculata, an inner zone called zona reticulata. Each zone secretes its own hormones as follows. Zona glomerulosa secretes mineralocorticoids, for example, mineralocorticoids. For example, aldosterone. The aldosterone increases sodium ion reabsorption and potassium hydrogen ion secretion. Zona fasciculata secretes glucocorticoids, for example, cortisol, cortisone. The cortisol, a glucocorticoid, increases protein. Figure 13.8. Cross section through suprarenal
gland
showing adrenal cortex and medulla. Yeah. Zona reticulata secretes adrenal androgens, for example, sex hormones. The adrenal androgens are of minor importance in males. However, in females, they lead to development of secondary sexual characters, such as development of axillary and pubic hair. Zona reticulata. Adrenal medulla. The adrenal medulla is the inner soft part of adrenal gland. It consists of cells which are arranged in anastomosing groups and are closely associated with sinusoids. The cells of adrenal medulla are called chromaffin cells because secretory granules within their cytoplasm is specifically stained brown when treated with potassium dichromate solution. In chromaffin, cells secrete catecholamines, which are of two types, epinephrine and norepinephrine. Release of catecholamines from the medulla is controlled by sympathetic nerves. Medullary secretions result from emotional reactions, sexual excitement, or stress. In general, the hormones of adrenal medulla prepare the body for strong muscular activity and gear up the body for a fight or flight response. Blood supply. Arterial supply. Each suprarenal gland is supplied by three arteries. Superior suprarenal artery, a branch of inferior phrenic artery. Middle suprarenal artery, a branch of abdominal aorta. Inferior suprarenal artery, a branch of renal artery. Venous drainage. The venous blood from each suprarenal gland is drained by one vein. Right suprarenal vein drains into inferior vena cava and left suprarenal vein drains into the left renal vein. Clinical correlation. Cushing's syndrome. It is a clinical condition that results due to hypersecretion of the adrenal cortex. For example, hypersecretion of cortisol, androgens, and aldosterone. The characteristic signs and symptoms of Cushing syndrome are accumulation of adipose tissue in face, moon face, neck, and the trunk of the body, increased blood glucose level, muscle wasting, atrophy of lymphoid tissue, and decreased immune response. Adrenogenital syndrome. It occurs due to hypersecretion of adrenal androgens and is usually associated with Cushing syndrome. It is characterized by early development of secondary sexual characters in male children and muscularization of female children. Pheochromocytoma. Neuroblastoma is a malignant tumor arising from cells of adrenal medulla. Neuroblastoma is a malignant tumor arising from cells of adrenal medulla. It occurs in infants and children below 15 years of age. Tumors that develop early tend to be highly malignant. Pineal gland, epiphysis cerebri. Pineal gland, epiphysis cerebri. The pineal gland is a small cone-shaped outgrowth front the roof of the diencephalon. It is present below the splenium of corpus callosum and is attached to the roof of the third ventricle by a stalk. The pineal gland is reddish brown and is about 10 millimeters long. It is regarded as photosensitive neuroendocrine gland structure. The pineal gland consists of epithelioid cells called pinealocyte, neur- neu- neuroglial cell, and many contains a structure. The pineal gland consists of epithelioid cell called pineal cytes. Adrenal medulla. The adrenal medulla is the inner soft part of the adrenal gland. It consists of cells which are arranged in an astromosine group and are closely associated with sinusoids. The cells of adrenal medulla are called chlorophyll cells because secretory granules within their cytoplasm is specifically stained brown when treated with potassium dichromate solution. The chromophene cells secrete catecholamides, which are of two types, epinephrine and norepinephrine. Releases of catecholamides from the medulla is controlled by sympathetic nerves. Medullary secretions result from emotional reactions, sexual excitements, or stress. In general, the hormones of adrenal medulla prepare the body for strong muscular activity and gear up the body for a fight or flight response. Blood supply.
Supply is supranular gland is supplied by three arteries: superior supranular artery, medial supranular artery, inferior supranular artery. Superior supranular artery branch of infraphrenic artery. এগুলো সব ব্রাঞ্চ টার্মস প্রত্যেকে সুপিরিয়র সুপ্রানাল আর্টারি কোত্থেকে আসছে এগুলো সব লাগবে, সব এর করে ছক করে পুরো বডির আর্টারি সাপ্লাই বুঝতে করতে হবে। মিডল সুপ্রানাল আর্টারি এ ব্রাঞ্চ অফ অ্যাবডোমিনাল অ্যাওটা। ইনফেরিয়র সুপ্রানাল আর্টারি মিডলটা সরাসরি অ্যাবডোমিনাল অ্যাওটার ব্রাঞ্চ, সুপিরিয়রটা ব্রাঞ্চ অফ ইনফ্রিওফ্রেনিক আর্টারি, আর ইনফিরিয়র সুপ্রানাল আর্টারি ব্রাঞ্চ অফ রেনাল আর্টারি। ঠিক আছে। Venous drainage. The venous blood from each supranular gland is drained by one vein. Right supranular vein drains into inferior vena cava and left supranular vein drains into inferior vena cava. Drainage. Venous blood from each supranular gland is drained by one vein. Right supranular vein drains into inferior vena cava and left supranular vein drains into the left renal vein. Cushing syndrome. It is clinical condition that result due to the hypersecretion of the adrenal cortex. Example: hypersecretion of cortisol and androgen and aldosterone. The characteristic signs and symptoms of Cushing syndrome are accumulation of the adipose tissue in the face, moon face, neck, and the trunk of the body, increased blood glucose level, muscle wasting, atrophy of the lymphoid tissue, and decreased immune response. Adrenogenital syndrome. It occurs due to the hypersecretion of adrenal androgen and is usually associated with Cushing syndrome. It is characterized by early development of the secondary sexual characteristic in male children and muscularization of the female children. Pheochromocytoma. It is benign tumor that arises from the chromatin cell of the adrenal medulla. It causes hypertension, hypersecretion of the epinephrine and norepinephrine. Neuroblastoma. It is malignant tumor arises from cells of adrenal medulla. It occurs in infant and children below 15 years of age. Tumors that develop early tend to be highly malignant. Pineal gland or epiphysis cerebri. Pineal gland is a small cone-shaped outgrowth from the roof of the diencephalon. It is present below the splenium of the corpus callosum and is attached to the roof of the third ventricle by the stalk. The pineal gland is reddish brown and is about 10 mm long. It is regarded the photosensitive neuroendocrine glands. Structure. Pineal glands consist of the epithelial cell called the preannulocytes and neuroglial cells and may contain the calcareous granules called brain sand. It is richly supplied with capillaries and sympathetic fibers. Hormones secreted by the pineal gland. The pineal gland secrete two hormones, melatonin and serotonin. The perineal secretion is influenced by light. Secretion is more in darkness than in light. Melatonin decreases the gonadotropin releasing hormone secretion from the hypothalamus and thus inhibits the development of the reproductive organs. It probably holds the onset of puberty until the appropriate time, and serotonin is an effective vasodilator. The perineal concentration, composed of calcium, magnesium phosphate, and carbonates, began to appear by the Middle Age. They are not indicative of degenerative changes as it was earlier. The secretory status of the gland is not affected by the appearance of the perineal concentration. Function of the perineal gland. The function of the pineal gland are contradictory and not yet fully known. However, the following functions are being attributed to pineal gland: coordinate the circadian and diurnal rhythms of many tissue of the body, inhibits the growth and development of the sex organs before puberty. Pineal gland controls of the onset of the puberty, modifies the activities of the adenohypophysis, neurohypophysis, endocrine pancreas, parathyroid, adrenal glands, and gonads. Hence, it is also called the master gland of the body. Clinical correlation, classification of the perineal gland. In Middle Age, calcareous deposit of the accumulate in perineal gland. The calcification of the perineal gland is often detectable in skull radiographs when it can provide a useful indicator or a space occupying lesion as there is significant displacement of the gland from the midline of such lesion. Blood supply. The pineal gland is supplied by the posterior cordial artery, a branch of the posterior cerebral artery. Thymus gland. Thymus gland is described in detail in chapter 1. Hormones secreted by the thymus gland. The thymus gland secretes a hormone called the thymosin, which is required for the development of T lymphocyte for the cell-mediated immunity. Secreted masses of endocrine cells in exocrine glands. In addition to the presence of endocrine tissue, is distended endocrine glands such as pituitary, thyroid, some endocrine tissues such as the islets of Langerhans or pancreas, interstitial cells, Leydig cells of testes, corpus luteum of ovary occur as secreted mass within a exocrine gland. Islets of Langerhans of pancreas. The pancreas is gonad with both exocrine and endocrine function. The major exocrine function is performed by the pancreatic acini, which manufacture digestive enzyme. Its endocrine function is executed by islets of Langerhans. The islets are highly vascular epithelial muscles secreted among the exocrine glandular tissue. Well-defined cell types is islets include the alpha cell and beta cell. The beta cell are far more numerous than the A cell. The other cells of the cells are also now recognized versus the delta cell, C cell. The B cell produces insulin, which plays an important role in carbohydrate metabolism, glucose from the glycogen. As a result, there occurs a decrease in blood sugar level and increase in glycogen level in the liver. The A cell produces the glucagon. It affects the opposite to that of insulin. The glucagon increases the blood sugar level by promoting the glycogenolysis in the liver.
Figure 13.9 Microscopic structure of pancreas. Note that alpha cells are towards the periphery and beta cells are towards the center. Note well. The blood sugar level is controlled by the opposite actions of insulin and glucagon. Insulin decreases blood sugar level, glucagon increases blood sugar level. Insulin decreases blood sugar level, glucagon increases blood sugar level. Clinical correlation. Diabetes mellitus. It is a clinical condition that results from deficiency of insulin. It is characterized by hyperglycemia and glycosuria of variable severity. Clinically, it presents as polyphagia, excessive eating, polydipsia, excess drinking of water, and polyuria, excessive urine. Diabetes mellitus is a clinical condition that results from deficiency of insulin. It is characterized by hyperglycemia and glucosuria of variable severity. Clinically, it appears as polyphagia, excessive eating, polydipsia, and polyuria. Gonads tests. The tests, two in number, are small ovate organs about 5 cm and 2.5 cm wide, located within the scrota. The testis has both exocrine and endocrine functions. The exocrine functions of testis is the production of spermatozoa, whereas endocrine functions of testis is the production of steroid hormones, for example testosterone. The testis is made out of large number of seminiferous tubules which produce spermatozoa. In between these tubules there are loose interstitial cells, also known as Leydig cells. These cells are endocrine cells. They produce male hormone testosterone. It is classified as a andro meaning male, because it stimulates the development of secondary sexual characters in a male at puberty. The other functions of testosterone are as follows. It plays an important role in the development of male reproductive organs during embryonic life. It is essential for maintenance of sperm production. It influences the behavior. It regulates the production of GnRH from hypothalamus. The Sertoli cells of seminiferous tubules produce a polypeptide hormone called inhibin, which inhibits FSH secretion from anterior pituitary. Ovary. The ovaries, two in number, are small almond-shaped organs about 2.5 centimeters long and 1.25 centimeters wide. They lie in the ovarian fossa at the lateral pelvic wall, one on each side. Each ovary is attached to the posterior surface of the broad ligament of uterus by a short peritoneal fold called mesovarium. As an endocrine gland, the ovary secretes the steroid hormones, which are required to prepare the endometrium, suitable for the implantation of the fertilized ovum. The hormones are produced by stromal cells, which are arranged into two distinct zones around the ovarian follicles. The inner zone known as theca interna, the outer zone known as theca externa. The theca interna cells secrete estrogen hormone, which stimulates the proliferation of the endometrium. The theca externa remain small and compact and have no known secretory function. After ovulation, the granulosa cells of the follicle undergo changes. They divide rapidly and enlarge, followed by progressive organization and fibrosis to form corpus luteum. The corpus luteum acts as an endocrine gland. The corpus luteum consists of central area for fibrosing blood clot and peripheral broad area made out of yellow lipid-rich granulosa lutein cells. The enlarged granulosa cells secrete progesterone. If fertilization takes place, the corpus luteum increases in size and continues secreting progesterone needed for making the pregnancy till placenta is formed and testosterone and takes over its function. Pregnancy until placenta is formed and takes over its function. If fertilization takes, the corpus luteum increases in size and continues secreting progesterone. diffuse neuroendocrine cells. There are certain scattered neuroendocrine cells such as renin producing juxtaglomerular cells of kidney and gut associated endocrine cells or enteroendocrine cells found is scattered in the epithelial layer of mainly stomach and small intestine. The enteroendocrine cells of the stomach produce gastrin, which acts on the funding glands of same organ, i.e. stomach, to secrete hydrochloric acid, and cells of duodenum to produce four hormones. Secretin causes secretion of pancreatic juice. Cholecystokinin causes secretion of bile. Pancreozymin causes secretion of pancreatic enzymes. Enterogastrin inhibits peristalsis of stomach to reduce in acid secretion. Most complex endocrine gland in the body, pituitary gland. Largest endocrine gland in the body, thyroid gland. Most vascular endocrine gland in the body, thyroid gland. Most variable endocrine gland in the body, inferior parathyroid gland. Most variable endocrine gland in the body, inferior parathyroid gland. All the endocrine glands pour their secretion follicles directly on the bloodstream except thyroid gland, which first stores in its secretion within its and then releases in the bloodstream according to the need. Third eye, pineal gland, master endocrine gland, pineal gland. Select the incorrect statement regarding the pituitary gland. Is the largest endocrine gland. Regarding the thyroid gland, all are true except its unit structure is called thyroid acinus. Thyroid gland secretes all of the following hormones except growth hormone. Regarding the parathyroid glands, which of the following statement is not correct? Their removal leads to increase in blood calcium level. Regarding the adrenal glands, which of the following statement is not correct? Right suprarenal gland is semilunar in shape. All are correct regarding the pineal gland except it secretes calcitonin. The hormone insulin is secreted by alpha cells of their islets of Langerhans. The hormone testosterone is not responsible for maintaining blood calcium level. All are correct regarding pituitary gland except its weight about 25 grams. A clinical condition called tetany occurs due to hypoparathyroidism. Chapter 14, Digestive and Respiratory Systems. Learning objectives. After studying this chapter, the student should be able to define the structure forming the digestive system and enumerate their functions. Describe salivary glands and discuss their functions. Elucidate the location and functions of pharynx, esophagus, and stomach. Delineate the parts of small intestine and enumerate its functions. Describe the accessory glands and digestive system and discuss their role in digestion. Define the respiratory system and its two divisions. Enumerate the components of conducting and respiratory positions of the respiratory system. Name the air passage of the bronchial tree in descending order of the size. Describe the location of gross anatomy of the lungs. Describe the location of the lungs. Correctly solve the review questions given in the end of the chapter. Digestive system introduction. The digestive system consists of digestive tract and accessory acted organs of the digestion.
System introduction. Digestive system consists of digestive tract and associated organs of digestion: teeth, tongue, salivary glands, liver, gallbladder, pancreas. It provides water, electrolytes, vitamins, and nutrients of the body with the help of the circulatory system. Function of the digestive system are as follows: water, electrolytes, vitamins, and nutrients to the body with the help of the circulatory system. The function of the digestive system are as follows: ingestion, taking in food through mouth, mastication, movements of the lower jaw during the chewing, and to pulverize food and mix it with the saliva, deglutition, swallowing of the food so that it passes from the mouth to the stomach, digestion, chemical breakdown of the food material, absorption, nutrition molecules absorbed into circulatory system through mucous membrane of a small intestine, peristalsis, rhythmic wave-like intestinal contraction that move food through the digestive tract, defecation, elimination of solid, semi-solid, liquid, waste material of food through the anus, digestive tract. Digestive tract extends from the mouth to the anus. Roughly, it is tubular passage and measures about 10 mm, 30 feet in length. Digestive tracts consist of the following parts from the proximal to distal and in successions: mouth, oral cavity, pharynx, esophagus, stomach, small intestine, large intestine, rectum, anal canal. And B. The term gastrointestinal tract is not synonymous with digestive tract. It actually stands to stomach and the intestine together. Mouth or oral cavity. Mouth or oral cavity is the first part of the digestive tract. It bound anteriorly by the lip, laterally by cheek, and superiorly by palate, and inferiorly by the muscular floor. এই যে তোমার ডাইজেস্টিভ ট্র্যাক্টটা ছবি দিচ্ছে: ওরাল ক্যাভিটি, ফার্নিংস, এসোফেগাস, স্প্লিন, জেজুনাম, ইলিয়াম, ডিসেন্ডিং কোলন, সিগমেন্ট কোলন, gallbladder, pancreas, duodenum, transverse colon, ascending colon, etc. The oral cavity communicates externally through a cleft between the upper and lower lips called the oral orifice, internally through the fuses into the pharynx. Oral cavity is divided into two parts: vestibular and oral cavity proper. Vestibular is a horseshoe-shaped space outside the gums and teeth, inside the lips and cheeks. Oral cavity proper is the space surrounded by the teeth and gums. The contents of tongue, which is attached to the floor. The teeth from two dental arches. One set is upper jaw and other set is lower jaw. Oral cavity is lined by the protective stratified squamous non-keratinized epithelium. Mucous lining of palate, lips, and cheeks contain minor salivary glands of the size of pinheads which keep the epithelial lining of oral cavity moist. Lips and cheek. The lips are muscular folds guarding the oral orifice and cheeks from lateral walls of the oral cavity. Lips and cheeks are lined laterally by the mucosa and externally by the skin. The lips and cheeks play an important role in the process of the mastication. They help manipulate the food within the oral cavity and hold the food in place for proper crushing and cutting by the teeth. The teeth. Teeth are embedded in the sockets of the alveolar process of mandible and maxilla. In an adult individual, there are 32 teeth and 60 in each jaw. In humans, the teeth are replaced only one diphenidont is contrast to non-mammalian vertebrates where the teeth are constantly replaced and throughout life. Propodont. The teeth in humans are heterodont. They very structurally are adapted to handle food in different ways. The teeth are of two following four types. Incisor, four pairs, upper and lower, are chisel shaped and adapt for cutting and sharing foods. Canyons, two pair of upper and lower, are cone shaped and adapted for the holdings and tearing. The premolar or bicuspids, four pairs upper and lower. Molar or tricuspid, six pairs upper and lower. The premolar and molars have the irregular rounded surface called the curves and adapted for the crushing and grinding the food. The tongue. The tongue is the large muscular organ in the occupies the most of the oral cavity proper. It is made up of two types of the muscles: intensive muscle which are within the tongue itself and extensive muscle which are outside the tongue but attached to it. The intensive muscle is responsible for changing the shape of the tongue, such as during drinking and swallowing, whereas the extensive muscle moves the tongue. The tongue is the major sensory organ for taste. The taste buds containing this receptor located on the dorsal surface of the tongue. The ventral surface of the tongue is covered by thin mucous membrane, which is reflected onto the floor of oral cavity proper. There is a median fold of mucous membrane between the tongue and floor of the mouth called the frenulum linguae. The oral cavity, along with lips and cheeks, holds the food in place during the mastication. The tongue also plays a major role in swallowing the food and water, etc. Pharynx. The pharynx is the funnel-shaped passageway approximately 5 inches long, which connects oral and nasal cavities to the esophagus and larynx. It receives bolus of food from oral cavity and passes into the esophagus. Pharyngo-esophageal junction is the narrowest site in the digestive tract. For distinctive purpose, তুমি শুনো না কি করো, shaped passageway approximately 5 inches long, which connected the oral and nasal cavities of the esophagus and larynx. It receives bolus of the food from oral cavity and passes it to the esophagus. Pharyngo-esophageal junction is the narrowest site of the digestive tract. For described purpose, the pharynx is divided into three parts: nasopharynx, oropharynx, laryngopharynx, according to the location of the part behind the nasal cavity, oral cavity, and laryngeal cavity, respectively. The nasopharynx is the part of the respiratory system, whereas the oropharynx and laryngopharynx are passage common to both the respiratory and digestive system. And B. Musculature of the pharynx is made up by the voluntary muscle, but it is not under the voluntary control. Inferior pharynx is lined by the protective stratified squamous epithelium. Esophagus. Esophagus is a collapsible muscular tube about 25 cm 10 inches long. It has a diameter of the 2 cm. It connects the pharynx to the stomach. Esophagus transport bolus of food from pharynx to stomach by the peristaltic movements. The esophagus is the most muscular part of the digestive tract. The musculature in the upper half of the pharynx is made up voluntary muscle, but it is not under the voluntary control. The musculature in lower half of the esophagus is made of the voluntary muscle. The lumen of the terminal portion of the esophagus is narrowed due to thickening of the circular muscle fibers it is in its wall, forming the gasopharyngeal lower esophageal sphincter. The sphincter prevents the reflex regurgitation of the food from stomach into esophagus. The presence of food in the esophagus causes the gastroesophageal sphincter to relax and allows the food to enter the stomach. The swallowed food takes about 5 to 9 seconds to the travels of the stomach. The sphincter at the upper end of the esophagus, upper esophageal sphincter, is formed by the sarcopharyngeal muscle of pharynx. It prevents the air from passing into the esophagus during inspiration. The lumen of the esophagus is lined by the protective non-keratinized stratified squamous epithelium. Numerous mucous glands in the squamous produce thick lubricating mucus. Stomach, Greek word gaster mean belly, is the most distendable part of the GI tract and lies into the esophageal region of the abdominal cavity below the diaphragm. It is jet-shaped pouch that connects the esophagus with the duodenum. About 2 liters of gastric juice is secreted daily by the secretory cells in the gastric mucosa. It consists of water, mineral salt, mucus, hydrochloric acid, intrinsic factor, and pepsinogens. Hydrochloric acid kills the indigested microbes and converts inactive pepsinogen into active pepsin. The function of the stomach are as follows: to store food as the mechanically shunt with gastric secretion, to initiation gastric of proteins, to move the food into the small intestine as a pasty material called the chyme. The food is stored in the stomach until it passes at a controlled rate into the duodenum. The outlet of the stomach, the pylorus, is guarded by a strong sphincter of circular muscle fibers called the pyloric sphincter. The stomach can accommodate volumes from 0.5 to 5 liter. The small intestine. The small intestine is long, hollow, muscular tube about 6 meter 20 feet that connects the stomach with the large intestine. It is located in the center of the abdominal cavity surrounded by the large intestine. Small intestine is divided into three parts: duodenum, jejunum, ileum. Duodenum. The duodenum is the fixed C-shaped tube about 25 cm 10 inch long that connects the pylorus of the stomach to jejunum. Concavity of the duodenum faces towards the left and occupied by the head of the pancreas. Duodenum receives bile from the liver and gallbladder through the common bile duct and pancreatic secretion through the pancreatic duct. Both these ducts until to form a common entity into the duodenum called the hepatopancreatic ampulla, which enters into the duodenum through its left concave aspects. It is duodenum digestion continuous and absorption of water and digestive products begins. Jejunum and ileum. Clinically, jejunum and the ileum together from the small intestine. Jejunum is about 2 meters 6 feet long, extends from the duodenum to the ileum. The ileum is about 3 meters 9 feet long. It connects jejunum with cecum. A small intestine is supported by the mesentery proper. Since the root of mesentery is only 15 centimeters 6 inch long, the small intestine is through the fold of called loops. The loops of jejunum tend to be located in the left lateral region of the abdominal cavity, while the iliac loops to be located in the pelvic cavity. Main function of the small intestine is absorption of nutrition from digested food. In order to suit this function, the surface area of mucus of the small intestine is extensively increased by the circular folds of mucus called the plica of the sulcularis and presence of villi. The villi are finger-like projection of the mucus. The intestine is exposed to toxin and microorganisms. To protect the intestine from the toxins and microorganisms, there are the aggregation of lymphoid tissue in the mucus called Terris patches and are usually concerned along the antimesenteric border. The concentration of the Pear patches is maximum in the terminal portion of ileum. The Pear patches get ulcerated in thyroid fever if not treated timely, and many cause intestinal perforation. Large intestine. Large intestine is 1.5 meter long and extends from the ileocecal junction to the anal orifice. It is called the large intestine. Not only it is longer than a small intestine, but also its diameter is larger than that of small intestine. Large intestine divided into the following parts: cecum, appendix, ascending colon, transverse colon, descending colon, sigmoid colon, rectum, anal canal. Large intestine has no digestive function, but it absorbs water and electrolytes from the chyme, which is received from the small intestine, a process that forms feces. The feces are stored in the sigmoid colon and then evacuated through the rectum and the anal canal. Mucous membranes of the large intestine does not have folds except in the anal portion. There are also no villi in the large intestine. The intestinal glands are long and characterized by the great abundance of the goblet and absorbed cell. In submucous layer, there is more lymphoid tissue than in any outer part of the alimentary tract, providing non-specific defense against resident and other microbes. After meal, the motility of the large intestine increased, and as a result of fecal matter, feces is pushed into the rectum. The digestion of the rectum acts as stimulation of intestine defecation reflex for the defecation to occur. But this local reflex is modified by the higher centers of that defecation occurs in an appropriate time and place. For rectum and the anal canal sac, Textbook of Anatomy, Abdomen and Lower Limb, Volume 3 2E by the Bhasham Ki Visram Singh.
Major digestive glands, salivary glands. These are excretory glands of digestion that produce saliva. The saliva acts as a solvent in cleaning the teeth and dissolving the food clinically so that they can be tasted. It also contains enzymes, tyline, lysosome, etc. and mucus. The tyline digests starch, lysozymes are bacterial and mucor lubricants the food and the oral cavity. The salivary glands can be classified into two types. Minor salivary glands. The minor salivary glands are numerous and are of the size of pinheads. They are located in the mucous membrane of palate, cheeks, and lips. They produce a small quantity of saliva. Major salivary glands. There are three pairs of major salivary glands: parotid, submandibular, and sublingual, which lie outside the oral cavity. The parathyroid gland is the largest and located below and in front of the external ear. The submandibular gland is located inside and below the mandible. The submandibular gland lies beneath the mucosa of the floor of mouth on the side of the tongue. The parotid duct opens into the vestibule of mouth opposite of the second upper molar tooth. The submandibular duct opens in the floor of oral cavity proper in onto a papilla on the side of the root of foramen of tongue behind the lower incisor teeth. The submandibular ducts, several in number, are small, open to the floor of the mouth on a ridge posterior to the papilla of submandibular duct. Note well, in human, 1 to 1.5 liters of saliva is secreted in a day. Clinical correlation: disease of salivary glands. The commonest surgical disease of the salivary glands are infection and calculous formation of the submandibular gland and tumors of the parotid gland. Mumps, acute and viral proctitis is the commonest medical disease of the salivary glands. Liver. The liver, Greek heper, is the largest internal gland of the body, weighing about 500 grams, 1.5 kg in adult. It is reddish brown and is located in the upper portion of the abdominal cavity, immediately below the diaphragm in the right hypochondric and esophageal regions of abdominal cavity. The liver is roughly triangular wedge shaped. The base is directed towards the right while the apex is pointed and reaches the fifth intercostal space in the mid-vascular line. Its diaphragm surface is related to the diaphragm and adjacent body walls, and its visceral surface is related to the abnormal organs. It is divided into major lobes, the left and the right. The two minor lobes, condate and quadrate. The vessel conducts and nerves enter and exit the liver through a depressed area on the inferior surface called porta hepatis. Porta means gate. The internal substance of the liver is divided into segments, hepatic segment, and on the basis of the ramification of the bile duct and hepatic vessel. Structure. The liver has uniform structure consisting of anastomosing sheets of hepatic cells called hepatic plates. These plates are only one or two cells thick and separated from each other by large capillaries called sinusoids. The sinusoids are lined with phagocytic Kupffer cells. The hepatic cells are enlarged into functional units called liver lobes. Each lobe is hexagonal. In the center of each lobe is a central vein, and at the periphery of each lobe are branches of portal vein and hepatic artery and interlobular bile duct, which together form portal triad. The liver has dual blood supply from hepatic artery and portal vein. The blood of portal vein, nutrient rich and deoxygenated, and blood from hepatic artery circulates through sinusoids and supply the liver cells and leaves the liver through hepatic veins into the inferior vena cava. Recently, the more correctly, it is found the portal lobules from the functional units of the liver. It consists of area of liver tissue supplied by one of the branches of portal vein. However, there are still smaller units in the liver called portal acne. Each portal acne consists of area of liver tissue supplied by one hepatic arteriole running along the line of the junction of two hepatic lobes. At each end of the sinus lies the central vein. The hepatic cells secrete bile into the thin channels called bile canaliculi located within each hepatic plate. These canaliculi are merely a space present between plasma membrane of adjacent liver cells. Bile canaliculi form to the intralobular ducts, which is turned from large intralobal ducts of portal triad. The large intrabolar joints join to form hepatic ducts that carry bile away from the liver.
The liver is an extremely active organ. Important function of the liver are metabolism of the carbohydrate, fat, proteins and alcohol, detoxification of the drugs and noxious substance, secretion of bile and production of the heat. Anterior liver anterior view আর inferior view. Anterior সামনেরটা আর নিচেরটা, রাইট লোব গলব্লাডার দেখা যাচ্ছে অ্যান্টেরিয়র ভিউতে, আর ইনফেরিয়র ভিউতে কার্ডিয়াক লোব, ইনফেরিয়র ভেনা কাভা, পোর্টা হেপাটাইটিস, রাইট লোব গলব্লাডার, তারপরে হচ্ছে তোমার লেফট লোব হেপাটিক আর্টারি, পোর্টাল ভেইন, কমন ইলিয়াক আর্টারি। বাইল সিক্রেশন, দি লিভার সিক্রেট অ্যাবাউট IL মানে কি about 1 liter of bile আছে। Liver secretes about 1 liter of bile every day into biliary tract. Among the constituents of bile are bile salts and bile pigments. The bile pigments produce distinctive color of the face. The bile salts helps in the digestion of fat by emulsification. Common liver disease, they include hepatitis, viral amoeba, amoebic, cirrhosis of liver, amoebic liver abscess, tumors, etc. The liver decrease often present with jaundice. Jaundice is yellow discoloration of skin caused by the excess bile pigment of the blood plasma. And B, any obstruction of the biliary tree may produce jaundice, but the two most common causes are gallstone in the common bile duct, carcinoma head of the pancreas, obstruction of the common bile duct. Gallbladder. Gallbladder attached to the inferior surface of the right lobe of the liver. Gallbladder stores and concentration bile, which it receives from liver through hepatic duct and cystic ducts. Bile is a yellowish green fluid containing bile salt and bile pigments. When the fatty crime enters into the duodenum from stomach, the intestinal glands in the duodenum mucosa release hormone called the cholecystokinin, which induces contraction of the gallbladder musculature, and bile is spirit into the duodenum. খুব সুন্দর একটা ছবি আছে, ডাক্ট অফ মেজর ডাইজেস্টিভ গ্ল্যান্ডস। এই ছবিটা সবসময় আঁকতে হবে। এই লিভার, গল ব্লাডার, তারপর হচ্ছে প্যানক্রেস, ডিউটেনাম, স্প্লিন, এই ছবিটা দেখো, এটা খুবই ইম্পর্টেন্ট ছবি, ডাক্টস অফ মেজর ডাইজেস্টিভ গ্ল্যান্ড। তারপর হচ্ছে clinical correlation, gallstone. A common clinical problems of the gallbladder is the development of gallstones. The bile consists of various salts, pigments, and the cholesterol, which become concentrated as water is removed. Normally, cholesterol remain is solution, but under the certain conditions, they participate to form the solid crystals called the gallstone. Extrahepatic biliary apparatus. It consists of the following structure: right and left hepatic ducts, common hepatic ducts, gallbladder, and the cystic ducts, bile ducts. Right and left hepatic ducts, after emerging from the porta hepatitis, join to form the common hepatic duct, which in turn join the cystic duct to form the bile duct, commonly called the common bile duct by the clinicians. Pancreas. Pancreas is a long, soft, and lobulate gland that extends across the posterior abdominal wall behind the stomach. It has expanded head near the duodenum.
Clinical correlation. Gallstone. A common clinical problem in gallbladder is the development of gallstones. The bile consists of various salts, pigments, and cholesterol, which become concentrated as water is removed. Normally, cholesterol remain in solution. But under certain conditions, they participate to form solid crystals called gallstones. Extrahepatic biliary apparatus. It consists of the following structure: right and left hepatic ducts, common hepatic duct, gallbladder and cystic duct, bile duct. The right and left hepatic duct, after emerging from porta hepatitis, join to form common hepatic duct, which is turned join the cystic duct to form the bile duct, commonly called common bile duct (CBD) by clinicians. Pancreas. The pancreas is a long, soft, and lobulated gland that extends across the posterior abdominal wall behind the stomach. It has expanded head near duodenum, certainly located a centrally located body, and a tapping tear near the spleen. It acts as both exocrine and endocrine glands. The pancreatic acne secrete pancreatic juice, exocrine secretion, that passes to the duodenum through pancreatic duct. The pancreatic duct joins the common bile duct (CBD) to form the ampulla of Vater, which opens into the second part of the duodenum. The pancreatic juice is highly alkaline, pH 8, due to the presence of carbohydrates. This helps to neutralize the acidic chyme as it enters the duodenum. The enzyme is the pancreatic juice are trypsin, amylase, and lipase. The trypsin helps in the digestion of amylase and lipase. The trypsin helps in the digestion of carbohydrate, amylase in the digestion of starch, and lipase in the digestion of fat. Pancreatic islets of Langerhans secrete hormone, namely insulin and glucagon. Endocrine secretion. Insulin plays a major role in carbohydrate metabolism. Clinical correlation. Pancreatic cancer. It is extremely fatal because it is vital exocrine and endocrine functions. Moreover, pancreatic surgery is a problem because pancreas is made of spongy vascular tissue, hence difficult to suture. Okay. Respiratory system introduction. The respiratory system is concerned with breathing, which is the process of inhalation and exhalation of air during respiration. The respiration consists of the following four processes: movement, gaseous exchange between the air and the lung and the blood, transport of oxygen and carbon dioxide in blood, utilization of oxygen and production of carbohydrate by the cells. The respiratory tract allows oxygen from atmospheric air to enter the blood into the lungs and carbon oxidize to leave the blood and enter the atmospheric air. Components of respiratory system. Anatomically, respiratory system is broadly divided into the following two parts. Upper respiratory tract URT, it comprises nasal cavities, pharynx and associated structures. Lower respiratory tract LRT, it comprises larynx, trachea, bronchi, lungs. Figure 14.5. Anatomical subdivisions of the respiratory system. Upper respiratory tract URT is shown in pink, while lower respiratory tract LRT is shown in violet. Functionally, however, the respiratory system is divided into the following two portions: upper conduction portion, lower respiratory portion. The conducting portion of respiratory system comprises nasal cavities, pharynx, larynx, trachea, bronchi, bronchioles, terminal bronchioles. The respiratory portion of respiratory system comprises respiratory bronchioles, alveolar ducts, alveolar sacs, alveoli. The main functions of the conducting portions of respiratory system are as follows: provide a conduct through which air can travel and end from the lungs. Figure 14.6. Conducting and respiratory portions of trachea and lungs.
Inspired air filters, worms, and myostens. The air while it is passing through it. The main moistens the air while it is passing through it. The main function of respiratory portion of respiratory system is exchange of gas, oxygen and carbon dioxide between air and blood. There air is absorbed and carbon dioxide is eliminated. Conduction and respiratory portion of the respiratory system. Following section describes the upper conducting portion and lower respiratory portion of the respiratory system. Nasal cavity. The nasal cavity is located inside the external nose. It is divided into two nasal cavities, a right and left, by nasal septum. The external internal openings of each nasal cavity are called nostril, external nares and corona, internal nares, respectively. Each nasal cavity has floor, roof, medial wall and lateral wall. The lateral wall of nasal cavity present three characteristic curved bony slabs called the conchae, which overhang the three anterior-posterior running passage called the meatus. Lining of the nasal cavity. The meatus of the lining of the nasal cavity are as follows: a small dilated area immediately above the nostril vestibule in the line by the skin, a stratified squamous epithelium having coarse hair called vibrissae. The vibrissae filter large dust particles that might otherwise be inhaled. The uppermost part, 2 centimeters square in each nasal cavity of the medial and lateral walls, where they meet to form a narrow roof, olfactory region. He is lined by specialized olfactory epithelium concerned with the sense of smell. The remaining large area of the nasal cavity respiratory region is lined by the pseudo-stratified ciliated columnar epithelium with goblet cells called the respiratory epithelium. The remaining large area of the nasal cavity respiratory region is lined by the pseudo-stratified ciliated columnar epithelium with goblet cell called the respiratory epithelium. Fine particles such as dust, pollen, or smoke are trapped in moist mucous lining of the nasal cavity. The cilia are microscopic hair-like projection from cell surface that waft the mucus and takes the foreign particles in its posterior. Fine particles such as dust, pollen, or smoke are trapped. The fine particles such as dust, pollen, or smoke are trapped in moist mucous lining of the nasal cavity. Cilia are microscopic hair like projection from projection cilia are microscopic hair like projection from cell surface that waft the mucus and the entrangled foreign particles in it posteriorly into the nasopharynx. The mucous membrane covering the inferior and middle conchi contains the dilatable venous sinus called the swell bodies, which warm and humidity the inhaled air. Thus, the respiratory warm and humidity of humidify the inhaled air. Thus, the respiratory function of the nose are to warm, moisten, and filter the air. Clinical correlation: rhinorrhea, the allergic reaction and inflammation of the nasal mucosa lead to abnormal engrossment of the soil bodies in the nasal cavities, causing the difficulty in nasal breathing and excessive discharge of the watery exudates from the nose. Rhinorrhea বলে এটাকে পানি পড়া। তার হচ্ছে pharynx. The pharynx is a funnel-shaped fibromuscular tube extending from the base of skull to the lower border of the sixth cervical vertebra, where it becomes the continuous with the esophagus. It acts as a passageway for both digestive and respiratory systems. It communicates anteriorly with nasal, oral, and laryngeal cavities. Accordingly, it is divided into nasopharynx, upper part, oropharynx, middle part, laryngopharynx, lower part. Nasopharynx has only respiratory function, hence lined by the respiratory epithelium. The paired auditory or exhalation tubes connects it with the middle air cavities. The pharyngeal tonsil or adenoids are situated in the posterior wall. The oropharynx has both respiratory and digestive function. The paired palatine tonsils are located in the lateral walls near the oropharyngeal entrance. The nasopharynx directs the food into the esophagus and air into the larynx. The air is further warmed and moistened as it passes through the larynx, voice box. It connects the laryngopharynx with the trachea. The lumen of larynx is kept patterned by its rigid wall formed by the hyaline and elastic cartilage. Hyaline and elastic cartilage that are unite by the membranes. The cartilage of the larynx are 9, out of which 3 are unpaired. Vice versa, the epiglottis, thyroid, and cricoid, and the 3 are paired. The thyroid cartilage is the largest and forms the piriformis of the front of neck. Adams appear in males. The cricoid cartilage completely encircles the lumen of larynx. The larynx is lined internally by the mucous membrane and covered externally with voluntary muscles. 2 pairs of the strong connective tissue branch with stretch anteroposteriorly across its lumen. The upper bands are called the false vocal cords and lower bands are true vocal cords. The space between the false vocal cords is called the rami vestibuli, whereas the space between the true vocal cords is called rami glottis. The latter is narrowest part of the laryngeal cavity. The true vocal cords produce sounds where the false vocal cords support the true vocal cords. Wall of the laryngeal cavity is lined with pseudostratified squamous epithelium, except the vocal cords which are lined by the stratified squamous epithelium. The larynx 7 serves 3 main functions. It serves to prevent food or fluid from entering the trachea and lungs from pharynx during the swallowing, and thus it protects the lower respiratory tract. It allows the passage of the air in the lungs during breathing. It serves to produce surrounds, hence the name of the voice box. In humidifying, filtering and warming of air continue as the inspired air travels through the larynx. Trachea. Trachea or white pipe is the flexible fibroelastic cartilaginous tube about 10 cm 4 inch long and 2.5 cm 1 inch in diameter. It lies in front of the esophagus, partly in the neck and partly in the thoracic cavity. About 5 cm 2 inch below the jugular notch, the trachea bifurcate into a right and left bronchi. The lumen of trachea is kept patent by the 6 to 20 incomplete C-shaped rings of the hyaline cartilage. The gap between posterior free end of the C-shaped cartilage is bridged by the band of smooth muscle trachea and a fibroelastic ligament. It is lined by the C-stratified ciliated columnar epithelium containing many mucous stretching goblet cells. The arrange of cartilage and elastic tissue in trachea prevent the
The arrangement of cartilages and elastic tissue in trachea prevents the nicking and absorption of airway during the movement of head and neck. The cartilages prevent collapse of tube when internal pressure is less than introthoracic pressure. For example, at the end of forced expiration, clinical correlation, tracheostomy, creating an opening in trachea and inserting a tube in it. It is a life-saving measure for obstruction in the upper respiratory passage. It is done in the cervical part of trachea behind the isthmus of thyroid gland through second and third tracheal rings. Bronchi, bronchioles, and terminal bronchioles. After a short oblique course, each bronchus enters the respective lung and gives off branches to each lobe of lung, in which it turns branch and rebranch like a tree. When the bronchi are reduced to the diameter of 1 millimeter, they are called bronchioles. Bronchioles divide again and given rise to terminal bronchioles, which are less again and give rise to terminal bronchias, which are less than 0.5 millimeter in diameter. The terminal bronchioles are the last stage in conducting portion of respiratory system. Respiratory bronchioles, alveolar ducts, alveolar sacs, and alveoli. The terminal bronchioles branch from respiratory bronchioles. At the level which gaseous exchange begins, the respiratory bronchioles give rise to alveolar ducts, which turn lead to alveolar sacs. The wall of the sacs being saculated resemble a branch of grapes with alveoli. The alveoli are the actual site of gaseous exchange and called functional units of lung. The alveoli form the parenchyma of the lung. The alveolar wall has characteristics elastic tissue made out of mainly elastic fibers. Because of these fibers, the alveoli can accommodate and expel air during inhalation and exhalation. Lungs. The lungs are the organs of oxygenation of blood in adults. They lie in the pleura cavity, one on either side of mediastinum within the thorax. Lungs are largely made out of spongy tissue and feel like a rubber sponge. In this highly elastic framework, bronchus, pulmonary artery, and pulmonary vein branch out. Each lung is divided into lobes and lobules segments. The right lung is divided by two fissures, oblique and horizontal, into three lobes, superior, middle, and inferior. The left lung is divided by a single oblique fissure into two lobes, superior and inferior. Each lobe is divided into segments called bronchopulmonary segments. Each lung has 10 bronchopulmonary segments. The lobes are supplied by lobar bronchi, whereas bronchopulmonary segments are supplied by tertiary bronchi. The lungs are closely covered by delicate and inseparable serous membrane called viscera pleura. Another layer of serous membrane lining of the wall of thoracic cavity, diaphragm and mediastinum called parietal pleura. The two layers are continuous at the root of lung formed by structures entering and leaving the lung. The potential space between the visceral and parietal layer of pleura is called pleural cavity. Thus, each lung is covered by a pleural cavity. Clinical correlation: asthma. It is an acute airway obstruction due to contraction of smooth muscle bronchospasm, increased secretion of mucus, and swelling of mucosa in response to allergy caused by variety of substances such as dust, pollen, or a particular food, etc. In patients suffering from asthma, the inspiration is normal, but partial expiration is impossible. Consequently, the lungs become hyperinflated and there is severe difficulty in breathing, dyspnea, dyspnea, dyspnea and wheezing. Asthma is treated with drug which relax the smooth muscle of bronchioles such as epinephrine. Length of the digestive tract 10 meters 30 feet. Most dilated part of the digestive tract, dilated stomach. Most muscular part of the digestive tract, esophagus. Long part of the digestive tract, small intestine. Chromophores are smaller in size and have little affinity for histological stains. Hence the name chromophore. These cells have little cytoplasm which usually does not have any granules. The chromophores are considered as exhausted cells or inactivate phase of chromophils. Chromophils are stainable and larger than chromophores and process secretory granules. The chromophils are of two types, acidophils and basophils. Acidophils
Smaller in size and have little affinity for histological stains, hence the name of chromophore. These cells have little cytoplasm which usually does not have any granules. The chromophores are considered as exhausted cells or inactive phase or chromophils. Chromophils are stainable and larger than chromophores and process secretory granules. The chromophils are of two types, acidophils, basophils. Acidophils. According to the function, the acidophils are classified into the following three types. Somatotrophs, they regulate body growth by secreting GH growth hormone. Corticotrophs, they act on suprarrenal glands by secreting ACTH, adrenocorticotropic hormone. Mammotrophins, they act on mammary glands by secreting prolactin hormones. Basophils, according to their function, the basophils are classified into two types. Thyrotrophs, they act on thyroid gland by secreting THS, thyroid stimulating hormone. Gonadotrophs, they act on gonadotropin by secreting FSH, follicle stimulating hormone, luteinizing hormone in females, and interstitial cell stimulating hormone in males. Par intermedia. It is a narrow zone consisting of small cells. The par intermedia is separated from pars anteriorly by the intergranular cleft. The cells of pars intermedia secrete a melanocyte stimulating hormone. In amphibians, melanocyte stimulating hormone controls the dispersal of melanin granules in melanocyte and are responsible for alerting the color of their skin. Part tuberous. It is an upward tubular extension of the pars anterior surrounding a part of the infundibulum. The cells within it are basophilic and contain small granules. The function of part tuberous is uncertain. Clinical correction. Effect of hypersecretion of anterior pituitary. The hypersecretion of both hormone of the anterior pituitary leads to gigantism and acromegaly. The most common cause of hypersecretion of GH is pituitary tumor. The excessive secretion of GH leads to excessive growth of bones, extra enlargement of internal organs, growth of excess connective tissue. Gigantism occurs when there is excess secretion of GH, while the epiphyseal cartilage of long bones are still growing. As a result, there is exaggerated and prolonged growth in long bones, resulting in gigantism. The affected individuals are abnormally tall. Small of them may be 3 feet tall or so. Acromegaly occurs when there is excessive secretion of GH after the ossification is complete. The affected individual present following clinical feature: prominent jaw or heavy bony ridges above the eyes, increased diameter of fingers, toes, hands and feet, valvulus and broad nose, enlargement tongue, no increase in height. Effect of hyposecretion of the anterior pituitary. The hyposecretion of GH of anterior pituitary in infants and children lead to dwarfism. Pituitary dwarfism. Affected individual is of small stature but is well proportionate and his mental development is not affected. Neurohypophysis. Posterior pituitary. Developmentally, it is a ventral outgrowth of the floor of diencephalon, but it does
Diencephalon.
not diencephalon.
Diencephalon.
Diencephalon, but it does not contain neurons. The neurohypophysis consists of narrow infundibulum and a swollen pars nervosa. The pars nervosa consists of cell called the pituitary and non-myelinated nerve fibers which originate from cell bodies of the neurons located in the hypothalamus. The nerve fibers constitute the hypothalamo-hypophyseal tract, which passes to the pars nervosa and terminates with swollen endings close to the blood capillaries.
Neurohypophysis, posterior pituitary. Developmentally, it is a ventral growth of the floor of diencephalon, but it does not contain neurons. The neurohypophysis consists of a narrow infundibulum, neural stalk, and a swollen pars nervosa. Infundibular process. The pars nervosa consists of cells called pituicytes and non-myelinated nerve fibers which originate from the cell bodies of the neurons located in hypothalamus. The nerve fibers constitute the hypothalamo-hypophyseal tract, which passes to the pars nervosa and terminates with swollen ends close to the blood capillaries. The pars nervosa itself does not secrete any hormone, rather it simply serves as a depot for the storage of the hormone and indirect hormone and oxytocin secrete in the hypothalamus. The oxytocin stimulates the contraction of the uterine muscle during the later part of the pregnancy and also has a contractile action on the myoepithelial cell of the alveoli and ducts of the mammary gland, ejecting the milk. The antidiuretic hormone ADH, also known as vasopressin, increases the permeability of the distal convoluted and collecting tubules of the kidneys for the reabsorption of water, thus inhibiting diuresis. Note 12. Besides secreting ADH and oxytocin, the neurosecretory cells of hypothalamus also secrete some hormone releasing factors, which release the pars interior to cause the release of LH, FSH, TSH, etc. Clinical correlation: oxytocin injections. The injections of oxytocin are given to women during labor if they are having difficulty in parturition. The increased amount of oxytocin assists uterine contractions and generally speed up delivery. The injections of oxytocin are given after the parturition cause uterus to release in size and the blood vessels to contract and thus minimize the chance of postpartum bleeding. Oxytocin injections. The most important function of antidiuretic hormone ADH is to conserve water within the body. A failure of ADH secretion produces a clinical condition called diabetes insipidus, which clinically presents as passing of large amount of urine 5 to 10 liters per day, excessive thirst, blood supply. The pituitary gland is supplied by anterior and inferior hypophyseal arteries from the internal carotid artery. The arterial supply of the pars anterior exhibits hypothalamo-hypophyseal portal circulation. The superior hypophyseal arteries first break up into capillaries at the median eminence of hypothalamus to take up the hypothalamic releasing hormones. Afterwards, these capillaries reunite to form vessels, which again break up into capillaries in the pars anterior and discharge the releasing hormones into the sinusoid of the pars anterior. Thyroid gland. Thyroid gland is the largest endocrine gland for the body and weighs about 20 grams. It lies in front of the lower part of the neck. It consists of two lateral lobes connected by isthmus. The lobes are conical in shape and are placed on either side of the upper part of trachea and lower part of larynx. The isthmus extends across the anterior aspect of the trachea opposite the third and the fourth tracheal rings. The thyroid gland is invested by true and false capsules. The medial surface of lateral lobe is related to two tubes, respiratory and alimentary tracts, two nerves, recurrent laryngeal and extralaryngeal nerves. The posterior surface of the lateral lobe is related to the carotid sheath containing common carotid artery, internal jugular vein and vagus nerve.
The unit structure of thyroid gland is called the follicle, which consists of a layer of cuboidal epithelial cells enclosing a cavity filled with colloid substance. The parafollicular cells are found in a delicate network of connective tissue between the follicles and amongst the cells that comprise the wall of follicles. Mostly, they are found deep to the basement membrane of the wall of the follicles. The cell of thyroid gland developed from the two different sources. Follicular cell developed from the endodermal cells of thyroglossal duct. Parafollicular cell developed from neural crest, or hormones secreted by thyroid gland. Thyroid gland secrete three hormones: T3 triiodothyroxine secreted by the cubital cells of the thyroid gland. The কি সুন্দর thyroid একটা ছবি দিছে thyroid cartilage, lateral lobe, isthmus, trachea. Cross structure of the thyroid gland. এটাই হচ্ছে thyroid gland. Microscopic structure of the thyroid gland: follicular cell, blood capillary, parafollicular cells, follicles filled with colloid substance. T4. tetraiodine or thyroxine secreted by the cubital cells of the thyroid follicles. Calcitonin. Thyrocalcitonin secreted by parafollicular cell. Thyroxine forms the bulk of hormones secreted by the thyroid. It includes mainly T3 and T4, and T3 and T4 are essential for psychosomatic growth of the body. They also maintain BMR, basal metabolic rate of the body. In peripheral tissue, T4 is converted into more active T3. The normal growth and maturation of organ is dependent on the thyroid hormone. Calcitonin plays an important role in calcium homeostasis. It lowers the blood calcium level when the calcium level is elevated. Its action is opposite to that of parathyroid hormone. The secretion of the thyroid hormone is regulated by THS. Decreased blood level of T3 and T4 lead by the negative to increase the secretion of the thyroid stimulating hormone. Dietary iodine is essential for the synthesis of thyroid hormones T3 and T4. Chemical correlation. Hypothyroidism. The hyposecretion of the thyroid hormone hypothyroidism decreases the rate of metabolism. Clinically, it presents as low body temperature, weight gain, reduced blood pressure, and apathy, a condition called the myxedema. If hyposecretion occurs during early development, in addition to decreased rate of metabolism, there occurs abnormal development of the nervous system, leading to mental retardation and or short stature, a condition called cretin. The cretinism is caused by the maternal iron deficiency, goiter. An enlargement of the thyroid gland is called the goiter. An enlargement of the thyroid gland without signs of hypothyroidism is called the simple goiter. It develops when there is iron deficiency in the diet. Iron deficiency leads to reduced secretion of the T3 and T4. Low level of T3 and T4 stimulates secretion of THS from pituitary gland. The increased secretion of THS causes hyperplasia of the thyroid gland. Hyperthyroidism. The hypersecretion of the hypothyroid hormone, hyperthyroidism, increased rate of metabolism. Clinically, it presents as high body temperature, weight loss, high blood pressure, exophthalmos, protrusion of the eyeballs, and enlargement thyroid gland. These symptoms known as thyrotoxicosis and Graves' disease. Blood supply. Thyroid gland is profusely supplied by the blood. The arteries supply the thyroid gland are superior thyroid artery, a branch of external carotid artery. Inferior thyroid artery, a branch of thyrosalpingoid trunk of subclavian.
Longest digestive tract 10 meters 30 feet. Most dilated part of the digestive tract stomach. Most muscular part of the digestive tract esophagus. Longest part of the digestive tract small intestine 6 meters. Narrow site of the digestive tract pharyngoesophageal junction. Largest internal organ of the body liver 1.5 kg. Largest salivary gland parotid gland. Most important function of the small intestine absorption of nutrients from digested food. Most important function of the large intestine formation of feces. Ducts of all major salivary glands open in the oral cavity proper except ducts of the parotid gland which open in the vestibule of the oral cavity. Part of the small intestine having maximum concentration of Peyer's patch. Terminal part of ileum. Large cartilage of larynx. Thyroid cartilage. Narrowest part of the laryngeal cavity. Rima glottis. Commonest site of tracheostomy. Cervical part of the thoracic through second and third tracheal rings. Gastrointestinal tract includes all of the following structures except esophagus. Most of digestion of food occur in small intestine. All of the following are the accessory gland of the digestive system except spleen. Ducts of all the following glands open in oral cavity except liver. Mumps is related to which of the following glands? Parotid gland. The conduction portion of respiratory system consists of all except respiratory bronchioles. The term lower respiratory tract includes all of the following structures except pharynx. The term upper respiratory tract consists all of the following structures except larynx. Regarding larynx, all of the following statements are correct except it is kept patent by the rigid walls formed by fibrocartilage. The gaseous exchange takes place in all of the following structures except terminal bronchiole. Chapter 15 Urogenital System. Learning objectives. After studying this chapter, the student should be able to identify the structures formation of the urogenital system, represent the gross structure of kidneys, state the gross features and functions of uterus, explain the structure and the functions of urinary bladder, characterize the structure and functions of urethra in male and females, describe the main organs composing of the male reproductive system, outline the structure and functions of accessory glands and male reproductive system, compare the contrast of male and female reproductive system, elucidate the location, structure and function of ovary, uterus, fallopian tubes and vagina, describe the main structure comprising the female external genitalia, correctly solve the review questions given at the end of the chapter. The urinary and the genital organs develop together to constitute the urogenital system. The male uterus serves as a common outlet. Therefore, urinary and genital systems are discussed together at the same chapter. Urinary system introduction. The urinary system is the most important excretory system of the body. It plays a vital role in maintaining homeostasis of water and electrolyte concentration within the body. Components of the urinary system. The urinary system includes following structures: kidney, paired uterus, paired uterine bladder, unpaired urethra, unpaired. The kidney secrete urine. Uterus convey urine from kidneys to the urinary bladder. The urinary bladder collects the stores urine, and urethra discharges the urine from urinary bladder to the exterior.